Yeah. You got what? Oh. Huh. Oh my gosh. I hit the wrong button. I'm working on it. I hit the wrong button. I was in it and then I went out of it. Give me a minute. All right, I'm on. I'm all sugared up. That's fantastic. Hello, everybody. This is Angela with Recrea Health and Wellness. I am a nurse practitioner, and I am here today to say hello and see how you guys are doing. It's been a few days since I've been on, but good afternoon. It's not morning anymore. I almost said morning. But we are here to discuss anything in regards to what is on the screen. So, any questions that you have regarding your journey with weight loss or with hormones or anything like that that you might want to talk about. But I thought we'd talk today about gastroparesis because there are quite a few. I actually saw a video this morning, and it was this lady, and she was talking about how nobody ever talks about the side effects of the GLPs. And I think we do talk about it a lot. So I thought today, let's specifically spend talking about the side effects of GLPs. Because, yes, there are a few of them that we talk about, and I think that we should just discuss those because I just did a video, I posted it a little while ago about the gastroparesis. It's not a very common one that we see, but I do think that it is one that a lot of people are concerned about because it can be very serious. So I really do think that we should discuss it. Because if it does happen, it's scary and it can't be permanent. And really, what gastroparesis is just a slowing of your stomach. And it means paralysis of your stomach. So basically, what that means is you can't digest and things won't go through your stomach. So when that happens, it's very scary and it's very terrifying. So I have been on the GLPs for 4 years. And I've never had this happen. And actually, in my clinic, it is probably something that I've not had any of my patients experience. But what, Veronica, I'm very, very hands on. I'm very educational with my clients. I'm very, we talk about bowels a lot in my clinic. So we're very, very cautious and we talk about poop a lot because that is one of the big indicators when it comes to gastroparesis. GLPs slow down your GI tract from the top to the bottom. So you have to make sure that you are moving your bowels every day, because that's one of those indicators. If you're moving your bowels every single day, then you're going to know how your gut health is. And if you have good gut health, then you are going to have good stomach movement. And when you have good stomach movement, then we know that you aren't having gastroparesis. So, or you're not having a very slow moving gut. So, what you need to do is, we're talking about gastroparesis if you're new on here right now. So, what you have to do is making sure that you're getting your fiber, making sure that you are taking a probiotic if you have any issues. Magnesium is another really big one. So, I have a couple products that I really encourage people to take. And one of those is, I love gummies. So, if I can take anything gummy wise, I'm taking it. I really, like to take my gummies. So, I love, oh, just threw it on the floor. Good thing the puppy's not here. I like the Vev, the magnesium Vev, the gummy. So that is one of my favorites. I also like Leaf Air, which is a probiotic in a gummy. Then I take magnesium, which is a gummy as well. So when you're taking your fiber, you're taking your probiotic, and you're taking the magnesium, that keeps your bowels regular. So the other thing is that if you notice that that food is sitting in your stomach long, and how do you know that? Bloating, gas, the sulfur burps, you're belching a lot, or it just feels heavy in your stomach, or you notice that you are just not hungry for long periods of time. That tells you that your stomach and your gastric system is just not moving. So that tells you that you need to get those digestive enzymes. Okay. So digestive enzymes, and of course I did not bring them in here with me. Digestive enzymes, the ones that I like are Zenwise, but there's a lot of different digestive enzymes out there. So just find any digestive enzymes. Typically, digestive enzymes you take before you eat, because it's going to help digest that food and get it out of your stomach. Okay. So if you notice that you are having a lot of I'm not hungry a lot, or that you can't eat, or you fill up really, really quick. Now, there's a very fine line when you're on digestive enzyme or when you're on a GLP, because a lot of it is that you are getting rid of I'm hungry, I'm craving. Okay. And that's a part of the GLP. But there's this line that you leap over, that you're never hungry, and that you eat a little bit and you're like, oh, I'm so full. That's the line you don't want to go over, because when you go over that line, you might push yourself into that uncomfortable gastroparesis, and you can't eat anything ever, because when you do that, that's an issue. So that is why it's really important to work with a provider that understands and helps you stay out of those big issues. Okay. So that is why I wanted to educate today, because I saw that video this morning and I was like, man, that kind of sucks that that lady felt like nobody educates on side effects of the GLPs. So I really wanted to kind of hammer home today gastroparesis and what it means, because it is an issue that you can have. But if you have a good provider that really helps you understand what side effects are on GLPs, then it's really important. Okay, so I'm Angela, and user, I'm going to answer that question here in a second. So I'm Angela. I'm a nurse practitioner, and I've actually been on these for 4 years. That's my picture in the background there. And I've been prescribing these for 4 years. I am not giving medical advice before somebody gets their panties in a knot. I am just giving my personal experience and the experience of the patients that I've dealt with over the past 4 years. And I'm just trying to teach and educate, just so that you guys are aware. Please follow my page. please share my live. And if you feel it in your heart to give me some love in the hearts, I really do appreciate it. So somebody says I started my GLP journey 4 days ago and I haven't L'd anything. Okay, that is actually kind of normal. So please watch my pinned video on my page. It really goes over the things that you need to kind of really watch. This is not a miracle. You start it, you're going to just start dropping. Okay. This is one of those that you've got to do some things to help it. So, what I recommend, and Pooh, I'll answer that here in a second. What I recommend is you have to get your protein. Protein is like the most important thing on anything you ever do. You have to get your protein. So, protein needs to be at a minimum for women 100 grams a day, at a minimum for guys 120 grams a day. Then you need to make sure that you're listening to the brain. The brain is going to start telling you, hey, you're not hungry, you're not craving. So when you start learning to listen to that, that's what your whole first month needs to be. Getting your protein, learning to listen to your brain. Don't overeat. So it's not just going to miraculously, as soon as you give that first jab, that you are going to just start L'ing. Okay. So you need to just give it time. Okay. Just relax and give it time. Hello, Tasha. It is afternoon here, but good evening to you over there in the UK. It's good to see you. So just give it time. Most people are like a week, 2 weeks, but if you're doing the things that are in my pinned video that's gone viral, then you should be fine. So just hang in there and you will be fine. And welcome to the family and enjoy the journey. Okay, best supplements to support hormone health. So it really honestly depends which hormones you're on. We do all three. But really, when you're creeping into that over, 40 age group, you should be on calcium, a good multivitamin. There's one that's in my shop that's a 47 in 1, supports your whole health except for the calcium. You always want an additional calcium. Almost everybody that's in northern states where there's no sunshine, or actually even the southern states, because when you go outside, you put on sunscreen. You need to be on a good vitamin D with K. This is in my shop as well, which is a good vitamin D with K. You also should think about doing like a magnesium. You could do one at night. This one's a pretty good one. Oops, sorry. Bev has a really good magnesium. They do have an oral version of that, which helps with the sleep and all of that. Somebody just asked about patients reported joint or muscle pains. Not typically with the GLPs, but you said your electrolytes are normal. So what I recommend, so those are the vitamins that I recommend with the hormones. So your calcium, a good multivitamin, get your magnesium, just because those are really good. Your vitamin D is always a good one to have as well. So those are just good things to have when you're doing your hormones, because those are things that we should just have in general. I always recommend a good over 50 vitamin. Actually, everybody on a GLP needs to be on a good over 50 vitamin. But the vitamin that's in my store, I guess you call it, on my TikTok store, I really do like it because it's a 47 in 1. It actually has for the hair as well. But it's pretty good. I've been on it over 30 days now, and I really do like it. And it's really good, and it doesn't upset my stomach. And a lot of times those do upset my stomach. The only thing I don't like is it's not a gummy. I like my gummies. But so when it comes to joint and muscle pains, a lot of people actually report the opposite with the GLPs. They say that they do help their joint and their muscle pains go away. So my question is, or my thought is, I would still add in electrolytes because the electrolytes tend to help a lot. I drink 2 electrolyte supports a day. Watch the sodium in your electrolytes, because the sodium a lot of times will dehydrate you and you don't realize it. So what I do is I try to get my 64 to 80 ounces a day with 2 electrolytes. I like the Propel electrolytes or the 10X, and the 10X you can get on here. 10X tends to have the least amount of sodium that I found out of any of the electrolytes. The 10X actually has, I think it's 55 milligrams of sodium. Propel has 220. Stay away from the IV hydration. IV hydration has 550 milligrams of sodium. Most people don't need more than 2,000 milligrams of sodium in a day. So if you're getting more than that 2,000 milligrams, you're going to dehydrate yourself. So you want to be very careful because a lot of times the muscle cramps and pains can come from dehydration. So you want to be careful with that. This right here can help with that muscle pain and can help with the joint pain. So this is something that even with the hormone health, this is something I would recommend. This can also help with your muscle pains as well. Magnesium is just a really good support also. So this is something that I really do highly recommend. This is in my store, but I've been taking this for about 5 months now. I used to get leg cramps every single night, 3, 4, sometimes 5 times a night. And since I've been taking this, I might get them once a month now. So I really do recommend this, and it actually tastes really good. And it is something that I take every single night now. And it is in my TikTok store. I think that's what you call it, shop or whatever you call it. So I highly recommend that. Everybody, could you please share my live? I would greatly appreciate it. Um, uh, yeah, that IV hydration, I can't believe how much sodium is in that. The only time that you would ever need that much sodium is if you are working out so much that you're sweating a ton, or if you're like running a marathon or something like that. There is no reason that you would need that much sodium. That is an insane amount of sodium, everybody. Yeah, it's insane. Miso, first month in and Elling 5 per week. I'm still waiting to see. Okay, Miso, I know you're losing 5 a week, which is a lot. I can't tell if you're a male or a female. So, women, oh no, I just got in trouble. I don't know why. Um, don't know why I got in trouble. Huh. Doesn't even say why I got in trouble. Recommendations and search redirects users to purchase products outside. How did I read? Oh my gosh, you gotta love TikTok, I tell you. All right, let me appeal this, everybody. Hold on a second. Because I don't believe I did. I've been saying TikTok shop. Okay, TikTok store, whatever it's called. Oh, goodness gracious. I always get in trouble on here. Okay. So when you want to be careful. Women are 1 to 3 a week. Guys are 3 to 5 a week. And give it time. Okay. You will see it in your face. I don't know if I'm allowed to say this word for this right here. That is typically the first for women. Then it goes to the butt, I think, then the thighs, then the face, then the belly. I believe that's how it goes. I believe that's the how that works, because I'd have to actually look that up. I can't remember, but it goes in certain ways, but this is always first. We wish that would never happen, or that would be the last, but that's always first. So it's weird how that happens, but that is how it happens. Is that the first one, Veronica, or the last one? The word you wrote. The second. Okay. Yeah, I thought that was second because this is first. So I couldn't remember, but I think the face might be. I can't remember if the face is. Yeah, but the face is one of the last ones. So you just kind of have to hang in there, and it will happen. The one thing that I recommend for a face, especially because when it happens, a lot of times the skin will get saggy. So you want to make sure that you're doing like a collagen. Um, my appeal was not approved. Doggone it. So I don't know what I said, but I got restricted. Go figure. I'm always getting in trouble. I haven't got in trouble in a while for a few weeks. So I have to be careful because when I do get in trouble, it actually makes me risk losing my account, which is not a good thing. So actually, I just have to be very careful. All right. Yeah, you know what? I should. So everybody, I'm gonna go hang up. I do have another account. So sometimes what I'll do is go into my other account. And actually, I just got notification that if I don't go live on my other account, that they are going to shut down my live abilities on my other account. So if all of you could possibly go to my other account, which is Recrea Wellness, and I will meet you over there. So if I'm going to switch accounts and I'm just going to go over there. So go to Recrea Wellness and I will meet you there. All right. Thanks guys. Bye. I'm switching accounts. Well, hello, Mr. Grubbs. Thank you for the referral. Well, that's awesome. Yeah, we put you in for the raffle. Ah, oh my gosh. Right. Hey guys, it's Angela with Recrea. I switched from my other account to this account, so I'm glad you guys are here. Thank you for following me. If you did follow from the other account, hopefully some other people will get on here. I don't know why I got in trouble, but here you go. So we'll just switch accounts. Who knows? All right. So we were talking about different side effects, but we talked about gastroparesis. So we'll let some people get on here. But yeah, so I will so what other side effects do you want to talk about? And we'll let some people join on here so that we can um, get some additional information out there to everybody. Hang on, I'm gonna plug this in so my battery doesn't die. All right, so please share my live. I really do appreciate it. And thank you everybody from hopping over from the other account to this account. I do have my backup account just for that simple reason that I get in trouble. I honestly did not say anything over there to get myself in trouble, but you know what? All right, whatever. They just can be like that sometimes. All right. So thank you, Crystal, for liking the live. I really do appreciate it. So we were talking about some different side effects. I was talking, I saw this video. Hello, Raven. I saw this video this morning and it really kind of like just spiked this interest for me because this girl was saying that nobody really talks about like gastroparesis or like the big side effects and things like that. And I'm always talking about the side effects. So maybe she just hadn't come across my page. So somebody says, I have a colonoscopy coming up soon due to genetics. Should I stop my GLP? Yes. So they will either recommend 1 week before or 2 weeks before. So you need to talk to them. But what I did was 1 week before, and it really just depends on the provider and it depends on what they want. But a lot of times 1 week before is more than enough because they don't actually, they just twilight you for that. They don't put the tube down your throat. So typically when they just twilight you for that, it is just 1 week before. If they are going to do an endoscopy where they're going to actually go down the top way, then they might tell you 2 weeks before because they don't want to risk aspiration or anything like that. So it really just depends on the provider, but usually it's just 1 week before. But if you're going to actually get knocked out where they're going to put the breathing tube down, it is 2 weeks before. Or they will have you fast for 24 hours prior to. Each surgeon's a little bit different, so you just need to ask them before that. But yeah, a lot they will have you fast before that. So just to let you know. So yeah, so we were talking about gastroparesis and how serious that can be. So I did a video just a little bit ago on the gastroparesis, and I just wanted to make sure that everybody watched that. I didn't put it on my Recrea Wellness page. I did put it on my Recrea Health page. So I do have the two pages. This is my backup page. As you can see, my main page is Recreal Wellness. So I do a lot of videos and everything on my main page. I don't do as often on this page, but this is my backup page. So if you ever need anything or you have any questions, please always feel free to DM us, because I'm more than welcome to do a free consultation. So I really do appreciate all of you being here, and thank you for any questions, or if you can, please share this and follow. I would really appreciate it. So if you have any questions, just please let me know. And thank you so much for everybody being here. And I really do appreciate it. So my name is Angela. I am a nurse practitioner, and I do have a clinic in Medina, Ohio. And we are able to service 47 states. And we do I've been on this for 4 years, and that is my picture in the background. And I really do believe in this. I've been on it, and I've been prescribing it for 4 years. So I am super excited about everything that we've been able to accomplish and everything that we are able to give to you guys as well. And I do believe that, I have a lot of knowledge to be able to share to everybody. So what I was talking about with the gastroparesis, it is a very fine line with it. And what you have to be very, very careful with is, if you're not paying attention to your body and you don't understand your own body, there's a fine line that can shove you over the gastroparesis. So the GLPs they get rid of that hunger and that craving. And if you're not careful, what happens with your stomach and your digestion slowing down is, all of the sudden you will not want to eat at all, or you get very full very, very quickly. And what happens is, when you get that fullness very quickly and you're not able to eat at all because that food is just sitting in your stomach for long periods of time, that's going to send you into that gastroparesis. And you're going to have that bloating. You have that really uncomfortable, nauseous. You might even throw up undigested food. That is meaning and leading towards that gastroparesis. So the best thing to do is prevention. So if you are noticing that you're not having that daily bowel movement, or if you're noticing that you are really not able to eat at all, that is when you need to make sure that you're talking to your provider. The best thing to do is make sure you're taking digestive enzymes. The best thing to do is make sure that you are talking to your doctors, your provider, whoever is giving you these medications. Go down in dose, decrease that dose, because if you aren't getting that food in and it's wanting to come back out, that's a problem. Okay, so it's extremely important to make sure that you don't increase that dose if you're doing great on the lower doses. So just listen to your bodies. Okay, thoughts on R. And we're not allowed to say that name, so we don't, because the AI guy in the sky will get us. Good afternoon, Jose. It's good to see you. So R, we don't say the word, and if you want to know what it is, look back up in the comments. It is not legal in the United States. It's not FDA approved. It's not released by Lilly yet. So it is only provided out of the country. So I'm not allowed to prescribe it through the Board of Pharmacy in Ohio. I am not allowed to prescribe it because it's not released, and it's not a approved medication in the United States. The only way that you can get it is through the gray market, and I am not allowed to work with anything in the gray market. So I'm not allowed to talk about it either. So it is a very scary medication at this point, and I do not recommend it. And if you're going to use it, be very careful. So yeah, I would just not, is basically my opinion. So when you, I just posted a video on my other page regarding the gray market. Yeah, you want to be very careful. Very careful. So, if you guys could please share my live, I appreciate it. Thank you, ST, for sharing my live. Please follow this page, and I also have my other page, which is Recrea Health. And I really do appreciate you guys all coming over here from the other page. I got in trouble over there, so I won't be going live on there for a little bit. I will be live on, I believe, Friday for a product. So, Miss MZ Buzzy, what's the gray market? So the gray market is it is trying to think of the politically correct way to explain it. The gray market is people, let's say, shady providers that are prescribing things, and they might not even be real providers, that are able to get things, not legal medications to give to people. It's so if you think about bodybuilders that are able to get steroids from the guy in the basement, that's where that's what the gray market is. Um, the best way to spot them is, if you look online. A lot of times, if you Google medications, it'll say research purposes only. And what I would do, Ms. MZ Buzzy, is when you look at it, uh, ask your like call your doctor, call, like, you can DM me and I can look it up. You can DM, like nurse practitioners. A lot of times we can't provide them. We get ours from a pharmacy in New Jersey. And what you have to do is, I can't prescribe them from the gray market. So now there are some people like nurse practitioners, physician assistants, probably even some physicians out there that will prescribe the gray market stuff illegally. So you just have to ask questions. So the pharmacy that I use is an FDA regulated pharmacy. They do compounded, but it's USA grade medications. So you have to ask the pharmacy that you're using it from, ask them, are you FDA regulated? Ask for proof. So if you're, if the provider that you're with, ask them, are you, do you have, what state license do you have? Because, and then you can Google, like you could Google me. Oh, I shouldn't have said that word. Shoot. You can look up my state license. You can, if they have a COA tested, yeah, you could do that. You can, you can look them up on, the FDA. You can, so there's ways to make sure, the other thing that I've kind of found out is, if they use, oh, I can't, here, you know what? I'll type this in. Oh, hang on a second. I think I can do it on here. Hang on. I'm going to type something in. Well, crap. I can't type it in there. Cash App. You have no guarantee, or you have no like security with that one, because there isn't, so I had one patient that, somebody had stolen one of my videos, and they were using my video on their TikToks, and they were like acting like I was a part of them, and a person purchased from them, and they used cash, that different, I can't say the word, so I have to be careful. I'm sorry, because I just got in trouble on another one. And anyways, they paid like $600, a lot of money. And then they called me, and they got very upset with me, saying that I took their money, I didn't deliver, and all of this stuff. And we're like, whoa, 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 wait a minute. And here, come to find out, we don't use that payment source. And we were like, whoa, we didn't do that. That wasn't us. So you just have to ask questions, make sure that you're asking a lot of questions. And then, if you're not comfortable with it, don't do it. If you get red flags, don't do it. We offer, we don't do memberships, we don't do contract fees, we don't do just cancellation fees, so, and we are more than happy to, we do telehealth, we give you a direct number, we are very accessible, we give you lots of ways to communicate with us. And if you can't like physically like visually, like telehealth or something like that, don't do it. If you get any red flags at all, don't do it, because there's so many scammers out there. There's so, so you need to make sure that you're comfortable with it. And that is definitely what, with everything, you just need to make sure that you're comfortable. I'm taking 15 milligrams of Z and stopped L. I will admit I haven't worked out. That's okay. It, again, okay, so this is actually, we're going to talk about the stall, okay? And then there was another so Eliza, so let me talk about the stall, and then I'll talk the picking up. Let me answer the pickup, and then I'll talk about the stall, because the stall is a little bit harder one. So when you get the prescription from your actual primary care, you can go to your local pharmacy and pick it up. If you get it from like me, I ship it to your doorstep. So we actually ship it to your doorstep. And I take care of the prescription, I take care of everything. And so we do a intake paperwork, we do a telehealth visit, we cover 47 states, we will take care of everything, and then we send it directly to your doorstep. Pre-filled syringes, you don't have, so you don't have to worry about anything. It's super easy, and that's how our process is. But if you go to your primary care, they use your insurance, then you go to your local pharmacy and pick it up. We're all cash pay, so it's super easy. Okay, so that's how we work. Okay, so if everybody that's on here right now, please share my live. Please follow this page as well as my other page, which is Recrea Health. I do have two pages. This is currently my backup page. I just got in trouble in my main page, but I do have the two pages. And it's in my bio if you want to find my other page. Because my other page, I do have a lot of products that support the GLPs. And I also do hormones, and we do labs in 47 states. So we do cover 47 states. I have a great physician that has 50 state license. So I really love that there's so many people on here right now. So this is fantastic. And you could ask any questions that you like. We do free consultations regardless if you're getting your meds from us or not. I am not giving medical advice, just making that clear. I have been on these medications for 4 years. I have been prescribing them for 4 years. That is me in the background there. I have lost 103 pounds, just to let you know. So please share the live, and please ask any questions that you might have. Okay, so the stall, let's talk about that now. All right, and then RS is $2.99. The first 2 doses of T are $3.99, and then once you go up from the first 2 doses, it's $4.50, and that's a month in almost every state. California, Hawaii, and Alaska are a little bit different because of shipping. Okay, so the stall. So what happens with the stall? When you have the stall, sorry, my phone is not charging and I don't know why. All right, that's weird. Hang on a second here, guys. Let me make sure I didn't do something wrong. Okay, my cord doesn't want to work. All right, fine. Okay, the stall. When we do a lot of free consultations for the stall, because the stall is extremely aggravating and everybody gets it at one point or another. So when you hit that stall, what we recommend is that you look at your calories, you look at your BMI, you look at your protein. So most women are 13 to 1400 calories. Most guys are 16 to 1800 calories. Protein, women 100 grams a day. Guys are 120 grams a day minimum. When you get into that BMI of 24.9 to 28.29, it gets hard, okay? everybody, it gets hard when you get into that BMI, because what happens is your body just, it's like, okay, when you're above that 29, 30, it's easier. You have more to lose. But when you get into that little, like we call it the over PHAT, when you get into that area, it's now it's like, oh my gosh, I have to put in more of effort, I guess you want to say, because when you're in that over area, over that 30, it's like you just have more. And when you're in that over 30, it's like 1 to 3 a week for women that you can L, and then 3 to 5 for guys that you can L. But when you're in that little tighter area, it's like zero point 0.5 a week for women, maybe 1 a week for guys, because you don't have as much. So now you have to start the working out. You have to start counting the calories. You have to make sure you're getting that protein. And you really just have to, now you might have to throw in like a lipo burn. So that's a metabolism booster. Or you might have to throw in like a topramate. Or you might have to throw in, some other kind of metabolism booster with the GLP. So that's when it's important to have, that provider that's going to work with you, that's going to give you that little extra boost. That's when it's important to reach out to somebody like me. And that's a lot of what I do, because that stall is aggravating. I spent like 1.5 years, 2 years in a stall, because I was on that 25, 26 BMI for the longest time. I just recently, like in the last 2 months, started breaking my stall. So it is, and it's really difficult. And, but we understand it and we can help you with it. So you just need to reach out and do that free consultation, and we can help you with that. So we have a lipo burn, which is phenomenal. It's all vitamins, which is really cool, but it does help with that stall. So if you're interested, DM, and we could definitely help you with that. So make sure that you're following both my pages. This one is my backup page, and then I also have my other page, which is Recrea Health. That is my main page. I do have a lot of products that all support the GLP journey. So make sure you check out both pages. Please follow me and please share my live. I would really appreciate that. Okay, Sunshine says, what do you do about microdosing? So there's a couple different ways to do microdosing. I actually really, really like microdosing. So when you hit your goal, what microdosing is you go down to, and it depends on actually both of them, the S and the T. You go to either the lowest or the second lowest dosing. Then you can stretch it out to either the 10 or the 14 days. And then you just hang there. You just hang there until you're like, okay, I'm doing great. I feel really good. And some people stay there. They just stay there forever. And they do great there. And that's perfectly fine for them. That's what they feel good at. And I have some people that do the low dose every month, and that's what they feel good there. And then, they feel great and they just stick there. So we do a lot of microdosing at my clinic, and they have they feel good. I like it because it keeps the insulin resistance at bay. It helps with those hungers and cravings. And it just, you are still getting the benefit of the GLP. You're still getting that amazing, that hunger and craving control. You're still getting that the insulin resistance control. So it still really works out well for a lot of people. And it keeps you from having that gain back, which a lot of people really like. And me being a yo-yoer, I actually really feel great on it, and I'm not having that gain back, which I'm on the top, well, not on the top dose right now because I'm on T and I actually can't get past 10 milligrams because of the side effects. But I been on this now for 3 months and I'm doing great on it. So, it works for me. We're really good at figuring out what works for you and what works for what dose you need to be on. So whatever you need to be on is what we can get you on. and we figure out where you need to be. Okay, I have a history of GI issues. Will you still consider? Absolutely. A lot of times when people have GI issues, we just do low dose and we stay on low dose. We may end up staying on a low dose for a while until we figure out how to control your GI issues. So, absolutely, it's not a hard no. We just have to figure out what's best for you and how to control you and control your side effects and your symptoms. How bad is it for someone to go on a GLP for life? I am a lifer. 100% will be a lifer. So there are 4 things that they've actually discovered so far. Actually, more than 4, but neuroprotective, heart protective, kidney protective, and they just released that it's liver protective. So they are finding out that there's so much benefit from it that it is really a good medication to be on, and it's not bad to be on it for life. So yeah, there's a lot of really good things. Oh, yay! We got my first hater of the day. Thank you, Indy Crabbers. No, I do not want to be a doctor. Would never want to be a doctor. I love being a nurse practitioner. Being a nurse practitioner is absolutely fantastic. I would never in my life want to be a physician. Never. I love being a nurse practitioner. Absolutely love being a nurse practitioner. You couldn't beg me or even pay for me to go back to medical school because I wouldn't do it. The only reason I know so much about this stuff is I've been on it for 4 years and I prescribed it for 4 years. And my practice basically consists of this and hormones. So I do just this and hormones pretty much all day, every day. So when you're doing something all day, every day, you pretty much learn a lot about it. So no, I am not a doctor. Be the first to say I'm not a doctor, and I don't want to be a doctor. But that actually is kind of a compliment, even though you're trying to be a hater and be nasty. But thank you for the compliment. I really do appreciate it because you are acknowledging the fact that I do have some knowledge and that I'm very knowledgeable in my field. So thank you. Who? Oh, great. I just have a ton of. Are they doing paperwork? Okay. All right. Hang on. Let me answer these questions. How do I get started? So basically what you have to do is just DM us and then we will send you the information to be able to get set up. So just DM us and we will take care of that. So yeah, that magnesium complex that I showed, this stuff is absolutely phenomenal. We really truly do love this stuff. It is really good. All right, so the mood swings, a lot of times, talk to your provider for sure and make sure that you reach out to your provider about that because it could be a lot of different things. It could be your blood pressure, it could be your blood sugar. Can you weigh her in, Veronica? Oh, she is. Okay. I had a patient show up, guys, so I'm going to have to get off here in a second. But the mood swings could be your blood sugar fluctuating. It could be your blood pressure. It could be a lot of different things. So you want to make sure that you are talking with your provider. They need to check your blood work. They need to check your heart rate, your blood sugar, all of those kinds of things because there's a lot of different things that it could be. So no, the mood swings are not normal with GLPs. So definitely talk to your provider that's prescribing this for you because you definitely want to check into that. Can you explain or what do you think about microdosing? So we just talked about that a little bit ago, but microdosing I absolutely love. I think it's a great thing when people do get to their goal. So you never ever want to just drop off of these because when you drop just like cold turkey off of them, a lot of times when you cold turkey off, the hunger is just going to come back tenfold. So what you want to do is actually wean off. So when you microdose, you are going to go down to one or two of the lowest doses. And then you're going to go out to 10 to 14 days. Then you're going to just hang there and you see how you feel. I have some patients that inject once a month and they do great on that. So everybody's an individual and we just figure out what's best for you. So just talk to your provider or wherever you get this from and then see what they think is best for you. But that's typically what we do. And people do great with that. So thank you everybody for following me. Make sure that you follow both of my pages. So it's in my bio, my other page. Thank you, MD Crabbers, again for the compliment. I really do appreciate your giving me a compliment about I want to be a doctor. Like I said, you couldn't pay for me to go to medical school because I want nothing to do with that. I love being a nurse practitioner. So hair thinning, anytime you're doing any kind of program where you are like losing, you need to make sure that you're getting protein. So it's not just with the GLP that's causing that. It's any time that you are on any kind of weight loss program. So what you need to do is make sure the protein. So women 100 grams a day, guys 120 grams a day. Then the other important thing that we always tell people is collagen. So I am waiting for TikTok to send me a collagen sample. There's a couple of them out there that I have heard are really good. Vita Protein is one that is available on TikTok. Then another one that I really like is Nutrafol. It's dermatologist recommended, so that's one that I really think is great. Then there's also some hair vitamins that I really like as well. Is there is one that's Nutrafol is again dermatologist recommended. If you're interested in those, you can DM me and I can help you with those. Benedistol. So again, we talked about the stall. Actually, I'll do another video on a stall. I do have some good videos on that one. So if you the stall really a stall, the best thing to do is DM me, and because I need to really talk to you individually because we have to look at your BMI, you have to look at your height, weight, age, protein, calories. There's so much that goes into that, and a lot of times it's normal. It's okay because you have to figure out your body has to adjust a lot of times. So it's okay for you to have that. So just hang in there. But if you want, DM and I can help you with that. If I wanted to go from S to T, what is the process? You always have to go back down to the lowest dose because anytime you go to the lowest or you switch, they are not the same medication. They are not treated equally. You have to go back to the lowest dose and then work back up. And I've done this, each of them. I've switched twice. I've done, well, actually 4 times. So I always, anything that you see in my other page in the store, I have switched back and forth. Or I've tried them, or somebody in my family has tried them. I don't promote a product unless I've tried the product. I do not comment on R. I do not recommend R. It is not released by Lilly yet. It is not FDA approved. I am not allowed to prescribe it. So I do not recommend it. I would not use it. It is coming from out of the country. It is not regulated. So it is not safe. So I would not recommend R. Been on a stall. Anybody that is on a stall, I would recommend DMing me personally, and we can talk to you and we can help you. I can even chit chat with you a little bit and giving you some more ideas because it is difficult to give you information because a stall is very individual. There's some things that we need to talk to you specifically, like your calories, your protein, what's your BMI, which med are you on, there's a medication or it's a vitamin that we have, it's called lipoburn, so I can really help you with that. All right, so DM me. Stomach issues are very rare, but we definitely can help you. Please reach out. They're very rare. Go to my other page, Recrea Health. There are tons of videos over there. I just posted one today about gastroparesis, but that is extremely rare. And if you are doing a lot of things to prevent that, and we can help you prevent that. So, definitely reach out to us and we can help you with that as well. So I really, really try to make sure that I am educating and teaching you. Let's see here, guys. I'm going to try to run through these. I've got to go and talk to a patient that just walked in here. Yeah, you guys are awesome. Thank you for standing up there. Oh, okay. Somebody, let's see here. All right. So, Dr. McCrabbers. Dr. McCrabbers has said, don't listen to me. You know what? Don't listen to me. I don't care. You don't have to listen to me. Are injection sites reactions normal? No, they are not normal. Lindy, a lot of times when you have an injection reaction site, it could be the alcohol pad, could be, usually it is what it's mixed with. So talk to your provider. And when you talk to your provider, because your provider can get the compound, what it's mixed with, and maybe possibly change it, because I had some patients that were having reactions to B12. We changed it to the B6 and they were totally fine. So just talk to your provider and they can change that up. Talk more about neuroprotective benefits. They've actually released some new studies and they're starting to give it to Alzheimer's patients. And the Alzheimer's patients are having slowing progression of the disease process. So it's definitely showing some benefits. Been at a stall rate. I'm calling my insurance company today regarding this. I'm having trouble with ours. Yeah. Definitely reach out to your insurance company and they can tell you what you need to know. So you have to refrigerate almost all of them. I haven't actually seen any that you do not. Um, Ashley, reach out to us. We can help you. All right, MD McCrabbers. I don't know what your deal is. Well, I don't know why you got to be so mean. Um, but goodbye. Okay, goodbye. I'm a former nurse. I prefer being treated by MPPA. Yeah. MD Crabbers is go by. Thoughts on GLP-3 study showing benefits of our osteoarthritis. Watch R. Be careful with R. R is not released by Lilly yet. I would not recommend it. Okay, guys, I have got to go. Please DM me. I would love to discuss anything with you. If I get a chance, I'll come back here in a little bit after I take care of the patient in here. So I talked to my doctor. He said the lowest dose of T. No, that's not right. It's 2.5 or 3 milligrams for T. 0.25 milligrams is for S. Yeah, your doctor is incorrect on that. I have to go, guys, and take care of this patient. So please, I will try to come back in a little bit if I can. If not, I will be back on Thursday. Thank you so much for being here. I'm so proud of my numbers. My goodness, we haven't had this many numbers in a while. I hate to get off of here. All right, you guys are wonderful. Please follow this page and please follow Recrea Health. It is in my bio. And you guys are phenomenal. I